Welcome to one of the most explorative sessions and presentations in this conference. But first, a huge thank you to all those who worked so hard to organize this conference and 4 years since 2017, but unfortunately was disrupted by the COVID. And a huge thank you especially to Dr. Hassan Al Thani and to Dr. Ala Awaisi for the amazing work and everyone who took part in organizing this session. My name is Suhad Daher Nashif. Formerly, I am Assistant Professor of Social Sciences in the College of Medicine in Qatar University. So nice to be back among my family. But I'm currently also a director of the postgraduate program for global health in Keele University in England and lecturer in sociology and anthropology of health. Before we begin, I would like us to dedicate this first moment and remember all healthcare professionals around the world who sacrificed their lives to save others' lives, including those in Qatar during the last COVID-19 pandemic, but especially those in Gaza now who have lost and are still losing their lives while they are trying to save lives in ambulances, in hospitals, and at the sites of the bombed houses, trying to give some respect to the remains of the dead bodies. May all of these sacred souls rest in peace. Thank you. I am honored to chair this fascinating session through which Dr. Hassan Al Thani will tell us about the brilliant journey that Qatar's health progressed through and explore together the prosperous future of it as well. Dr. Hassan Al Thani, MD, MBA, and many, many other honorable titles, is Senior Consultant and the Head of Trauma and Vascular Surgery Sections of Hamad General Hospital in Qatar. He is also a Fellow of the American College of Surgeons, Fellow of the Royal College of Physicians and Surgeons of Glasgow, Fellow of the Royal College of Physicians and Surgeons of Ireland, and Fellow of the Royal College of Physicians and Surgeons of Canada. Dr. Al Thani graduated from the Royal College of Surgeons in Ireland and completed his surgical training in both Qatar and Canada. He completed his training in general surgery, trauma, and vascular surgery at MC Master University Faculty of Health Sciences in Hamilton, Canada. In 2004, after the completion of his training, he joined Hamad General Hospital as a senior consultant in the Department of Surgery. In the same year, he established the Vascular Surgery Section. He has a master's degree in logistics, hospitals management from International Transport and Logistics Institute, Cairo, Egypt, and recently finished his International Executive Master's degree in Emergency and Disaster Management in Georgetown University, Qatar, which means non-stop explorer and scientist. Dr. Al Thani is the author or co-author of more than 200 publications and peer-reviewed articles, and he also has 9 book chapters. In addition, Dr. Al Thani was involved in a number of administrative duties, which included board member of Hamad Medical Corporation from 2006 to 2008, chairman of the Organ Transplant Committee from 2008 to 2009, board member of Weill Cornell Medical College in Qatar from 2008 to 2012, executive board member of the Gulf Vascular Society from 2007 until the present, and president of the Gulf Vascular Society from 2009, and board member of Qatar Medical College and chair of ATLS chapter, among others, and so many other things that we just don't have time, and Dr. Hassan will tell us about. So please join me and welcome Dr. Hassan.
Assalamu alaikum wa rahmatullahi wa barakatuh. And thank you for the organizing committee, for the podium, and for the kind invitation. Thank you, Sheikh Asma, and the rest of the team for amazing conference. And also the opportunity to be here in Qatar University. I always explore Qatar University from one corner at a time, so I don't get, the coronary spasm that I'm supposed to be in Qatar University. which is great actually. The conference, which entitled Cultivating and Collaborative Culture, is sharing pearls of wisdom for the 11th International Conference of International Professional and Practice and Education, something amazed me, and when I read about it, actually, I was intrigued by the activity that's been taken through this conference. So, my title of this presentation is The Progress of the Health Through the Years, Our Health, Our Future. And my name is Hassan Al Thani, as stated earlier, and I have nothing to disclose except that I am Qatari and I work at Hamad Medical Corporation. The specific objective of this presentation is to highlight the development of the healthcare system in Qatar over the last 100 years. The ethos behind development of healthcare system in Qatar can be captured precisely by the word of His Highness, the Amir Father Sheikh Hamad bin Khalifa Al Thani, when he stated, "A healthy citizen are the greatest asset any country can have." Cultivating collaboration is critical to the success of any health system. Collaboration within and across discipline and practicing is essential to create a holistic, integrated system that can focus on prevention as well as reaction. Qatar National Health Strategy 2018-2022 stated system-wide priorities will enable Qatar to develop genuinely integrated model of care that serve to maintain well-being while making sure that people receive well-coordinated care. Well, let's start in the beginning of the 19th century. At that time, Qatar primary industry was barreling and fishing. The country was marked by widespread poverty, malnutrition, and disease from the collapse of the pearl trading in the 1920s. And this map of the growth of the city is illustrating here in the top Sheikh Abdullah bin Jassim when he actually signed the treaty in 1913 with the British to actually be part of the British colony. The Doha was a tiny place on the sea. An aerial photo of Doha shows the settlement at that time was along the shore of Wadi Msherib and extend to the east to Farij al-Sulta. The extension was supported by the growth of the population from 45,000 to 120,000, with the movement of people from Abu Dhabi to Doha living in Farij al-Sulta. And Sheikh Abdullah was actually housed in the corner there in the far picture on the left side. And currently this is the National Qatar Museum. This photo was taken in the beginning of 1950. Behind the clock tower, you can see the start of the building of the Diwan Amiri was starting to be constructed. And in the beginning of the 80s, the population of Qatar went to 350,000, and currently in 2010 to 2020, the population went from 1 million to almost a 3 million population, a sudden increase of the population and influx in a preparation for the build of the infrastructure of the country. And this is an aerial view of the country. At that time, the Qatar health was not existing. Was before 1948, folklore or traditional medicine was the way people were treated. And there were actually 40 men and 42 practicing female in Doha, practicing herbal medicine, a'shab, applied therapy, cautery or wasm, cupping or bloodletting, massage, hydrotherapy, and dietary practice as well as a spiritual practice. Sayyid Muhammad bin Saleh was the first official registered person in Doha to practice herbal medicine. Muhammad was a merchant of oil, perfume, and herbal in Doha, lived in Barahat al-Jferi, behind Al-Qubab Mosque, which is currently in Souq Waqif. Bin Abbas and Mukhtar were known as a herbal physician in Souq al-Irani and Souq Waqif currently also, which part of it. And Abdul Aziz bin Ahmed Al Thani, the head of the security in 1930, was known for his actually successful treatment with cautery. Saeed al-Badid was also famous, the picture is standing there in the behind, and Saeed al-Badid continued to practice actually cautery until 1990s. Jamla al-Salaiti lived in Salaiti town and was famous for her treatment of broken bone and also healing of the wounds. And Asma bint Ahmed al-Hitmi, who lived in al-Hitmi Farij, she was only treating women and specialized in herbal medicine and tonic for prevention of care. Sibika bint Ahmed al-Jammal was known as the mother of Doha. She actually delivered most of the people who lived in Barahat al-Jferi. And Barahat al-Jferi, I guess at that time, considered Hamad Medical City currently. Isa bin Ghanem al-Malki, who lived in al-Hitmi town, was famous for his Quran healing. And Al-Buhamid was practicing vocal medicine, or what's called as mahu, which is erasing. He used Quran verses written in rose water and saffron, and he dipped it in Zamzam water. And people will take it in the morning and in the afternoon and thought that it will actually transmit the healing process from Quran to the individual. The formal medical services or treatment started with the discovery of oil in 1939. This was discovered first by the Anglo-Persian Oil Company, which was stationed in Iran, and it was stopped after the beginning of the conflict, the World War II conflict. Re-established again, and it took over by the Iraqi Petroleum Company, which was, the headquarters was in Bahrain, and it was functioning in Al-Basra. The first field was in Dukhan, and then the two companies agreed to develop the Petroleum Development Qatar Limited, which became QP, Qatar Petroleum, and currently the Energy, Qatar Energy. Although the discovery and the production of oil started early in the 1940s, the income of the oil was not there until the end of 1940s. During that time, Sheikh Abdullah bin Jassim asked actually the British to come and assist the medical service or to establish the medical service in Doha. And a British government doctor from Bahrain visited Qatar in 1945. He stated, Dr. Steele, found Doha fairly clean, and when he was asked about the epidemic, was told that malaria was very bad, smallpox appear from time to time. Dysentery was fairly prevalent, and few cases of typhoid fever, but possible many were not diagnosed as such. And there was a few cases of tuberculosis. Well, Sheikh Abdullah was not happy about this, and he asked the British government to support him to build a hospital and also to supply the medical facility and doctors. There was a back and forth discussion between the British government in UK and also the East Bombay Company in India to discuss how to actually finance this process. Eventually, Sheikh Abdullah managed with a group of actually donors to build the hospital without the British support. But the British authority acknowledged the serious need for hospital in Doha, but were unwilling to help fund and build it. Although internally, corresponding revealed that there was concerning that idea of providing some money if they could install a British doctor who would also be a political agent for the British. So there was some consideration, but also a refund from it to be actually controlling the system. The first hospital which was open was Al Jasra Hospital, and some call it Corniche Hospital. It was one-floor hospital, and Sheikh Abdullah went on to discuss with actually the American mission. The American mission were present in Iran, Kuwait, and Bahrain, and the American mission agreed to support Qatar on providing a doctor from India, and Mary Allison moved from Kuwait to serve in Doha. But the mission stopped after their doctor actually had contracted pulmonary tuberculosis while he is visiting Saudi Arabia, and the mission stopped after 2 years. The British government decided after that to actually supply Qatar with doctors to run the service from 1950s onward to 1956. Palmer, who was a surgeon in the British Army working in Libya, was moved to run the service. He insisted to bring his partner, a family physician called Dr. Gutting, to come to work with him. With that, also, Dr. Abdul Latif from Pakistan was brought as a surgeon, but he worked in the emergency department. And Dr. Kingston, who visited Doha from Bahrain as a primary health provider, stayed in Doha also. And and Indian doctors came. The wife of all the doctors became the nurses, and they also brought nurses from India to support the service. The hospital was divided in two sections, a ladies or female section and male section, and they were actually separated only by a corridor. The hospital provides food in the morning, in the afternoon, in the form of rice and curry. And outpatient is people sit in the foyer of the hospital and actually will be seen on a regular basis. Family were allowed to stay with their loved one when they are admitted, and they can also cook while they are in the hospital at that time. In 1956, Dr. Palmer and a group of the British doctors decided to leave because the payment was not great from the British government, and they actually left the country. And with that, the nurses left with them too. This is the farewell party for Dr. Palmer and the group of the nurses that left on the same time. In the same period of time that before the movement of the British doctors, Sheikh Ali bin Abdullah at that time became the ruler and contracted with a British company to actually start the foundation of Rumaila Hospital. John Harris, who was an engineer also in the British Army, worked in the Far East, stationed in Hong Kong took actually that responsibility and designed Rumeila Hospital. And it was built by the end of 1956. In the right side, Dr. Brindeville, he's an Australian, finished his training in UK and landed in Doha by mistake because he actually ran out of money. In the same time, the Rumeila Hospital opened and he was recruited. And he stayed until he retired in Doha. Also, the recruitment of Parveen Murray, she is Armenian, Lebanese, and her husband, who's sitting beside her, he's not a physician, but he became the chief medical officer for Rumeila Hospital, and they stayed from 1955 to 1965. She was a pediatrician, and she was covering also the obstetric ward from now on when they need her. She and her husband were the first Arabic-speaking employers in the government at that time. And the petroleum company donated a bus which was converted with an X-ray machine to be a surveillance for TB in the country, which roamed around the country, as well as to be a vaccination, mobile vaccination unit for smallpox. Al Jasra Hospital was also developed into two-floor hospital and was converted to maternity service, chronic disease, psychiatry, TB, and Dr. Guten was in charge of the hospital at that time. Dr. Elizabeth who actually was practicing as an obstetrician with a little practice, because in Qatar, a lot of Qatari were delivered by Qatari midwife at home, so the practice was very slow. But when she moved out, Guten worked as obstetrician, and he learned the skill of the obstetrician from the nuns, the Italian nuns in Derna in Libya while he was stationed there. Also, he worked as a vet for the Oryx actually herd, which was brought and currently in a Shahaniya area. The dental department was established in 1953, and there were two clinics in the rural area, which Rayyan, currently in the middle of Doha, and Al Khor was established. At the same time, the Medical Board Committee was established for the recommendation for treatment abroad, because the population growth was very high and the need for treatment was expanded quite significantly. The treatment abroad was in Bahrain, Iran, India, and Lebanon. The Department of School Health was established in 1958 under the Ministry of Education. Before this, the aspect of healthcare had been covered by sending a medical officer from the hospital to the school during working hours and to the desert during the weekend to cover the different parts of the country. A new women's hospital was opened in 1959, and this new hospital, 1 year before that, they recruited Dr. Iqbal Abdul Wahab Hamdi. She was trained in UK, but she did not finish her obstetric certificate, but she was well trained. And she joined. She was a very powerful leader, and she had a good communication with the public, so she managed to convince the government to switch this new hospital from infectious disease hospital to obstetric and gynae hospital, and she was leading the hospital. She was called, or the hospital was called, Hamda Hospital. The two new buildings which was made here, one, the East Clinic, converted to the psychiatry Hospital, and the other one was the Infectious Disease Hospital, and Al Jasra Hospital at that time was demolished. Also, the new medical policy was established in 1960s, and just to actually translate what is being said, all medical care free for all living in Doha, and a private airline or a private plane to transfer patient abroad for treatment on the government expenses established in 1960s. Also, the Ministry of Public Health in 1946, there were a decree to reorganize the health service by grouping the public health and medical service into one unit known as the Ministry of Health. And the subspecialty department was also established in 1965. The first was the Forensic Medical Department, followed by the Medical Department, was chaired and run by Dr. Davidson from UK. Pediatric section was run and managed by Dr. I just forget him now, but it will come, Midhat Rida. Midhat Rida was actually a pediatrician who came from Egypt, but he is trained in UK, and followed by the opening of ophthalmology, ENT, anesthesia. And at that time, most of the doctors were from UK. Also, the ambulance service was established in the late 1960s. The purpose of the ambulance service was mainly to deliver a patient to the hospital and also to take the patient from hospital back to home. Outpatient clinic was opened in 1967 in Rumaila Hospital, followed by a clinic in Al-Wakra Hospital. And the program, sorry, I went before. The visiting consultant program was established in 1969 because people were traveling abroad for their treatment on the government expense was now mounting too high, and the government decided to bring the expert rather than sending the patient. But unfortunately, this is continuing until today. So in 1969, the international consultant in all subspecialty of medicine were invited to treat patient and advise administration on how to improve the service. And this program continues until today. The Ministry of Public Health was established in 1970, and the first minister, I believe, was Sheikh Abdulaziz bin Ahmed Al Thani. And the role of the ministry was to develop a human resource to the full, advance social development policy. Social welfare is carried out in the form of monthly pension paid by the government to elder, widow, orphan, and divorcee. And the residential care is provided for the mentally retarded and other in need was under the Ministry of Health. Ministry of Education was established at the time, and at that time education became free for from primary to university for all boys and girls live in Qatar regardless of their nationality. A grant was also awarded to the needy student by the Ministry of Labor and Social Welfare. Rumaila Hospital, when it's open and function, actually attracted a lot of publicity. There was articles in the Lancet, Civil Engineering, British Medical Journals, Anglo-Arab Trading, and also the Nursing Mirror. And also the hospital at that year won the prize in the Berlin Trade Fair. So it was actually achievement for the country and milestone. Also, in 1979, Queen Elizabeth visited Doha and specifically visited Rumaila Hospital. At that time, Rumaila Hospital had two extensions with a new development. One, it was the new male section or ward, and the second one was the building of extension of the burn unit and the intensive care unit, and the coronary care unit was established. The burn unit was the first in the GCC country to be established as such. In 1974, now Qatar independent, and the government decided to contract with a UK company to establish the foundation of Hamad General Hospital. And in 1975, the American University of Beirut and Dr. William Beryl was assigned. He was actually the planner in San Francisco, but he was assigned to review the plan of Hamad Medical Hospital at the time. The government also contracted, and I was really surprised that they went through all the right steps. The Swedish development were involved in establishing the intensive care unit for Hamad Hospital in 1976. In 1977, they also worked with the National Health Board of Denmark to actually review and establish the master plan for the medical and public health service needed for the state of Qatar. They hired Reinhardt, an American, who ran the administrative part of Hamad Hospital, and in 1977, University Association of International Health in Boston, Massachusetts, was involved in the establishment of the primary health section in Hamad. Hamad Hospital was 616 bed and has all the subspecialty included in that. And in 1985, a women's hospital was opened, and the designer of the women's hospital was asked again, John Harris, to come back to design the new hospital, who designed Rumeila Hospital at that time. Hamad Medical Corporation, established with a vision and mission to be an internationally recognized world-class center for health excellence, and with the value of respect, reliable, excellent, safe and a clean environment, patient-centered care, empowerment, concern with the community well-being, and teamwork with interdisciplinary and collaborative. HMC expanded over the past few years really extensively, from one hospital in 1957 to 12 hospitals in 1917. The population went from 45,000 to almost 2 million by 2017. And this expansion continued to grow. Currently, the Qatar healthcare facilities consist of 4 areas: Ministry of Health, Qatar, other government sectors, non-governmental health sectors or care, and the private sector. Hamad Medical Corporation is the largest in the country, with the primary health also to follow. Under Hamad currently, there's 18 hospitals, and the primary health is 29 centers. The other government sector is the Army, the Ministry of Interior, the Ministry of Energy, and also the Red Crescent and Sidra and Espitar. The private sector consists of 10 hospitals. The first Qatari nurses were actually of a milestone. Aisha Rashwan in 1967 became actually recruited from Egypt to help recruiting nurses, and she was very active. She went to families at home, advised the families to actually recruit their daughters into the nursing profession. You can see in the corner here one of our Dean of School of Nursing, Nabila Almir, who actually was one of these. Nasra Nubi was trained also in Qatar and moved to Ireland to further her study. The first doctor was graduated, Abdullah Al-Bakr, in 1966 followed by Muhammad Al-Harami, and then the first one graduating from the state was Dr. Hajar, who became the Minister of Health, and then the generation to follow. Qatar University is a lead in providing actually the next generation for our graduates, from the College of Health and Science all the way to the recent establishment of the College of Nursing. And also, Qatar Foundation, attracted different international universities to join with Weill, Cornell, University of Calgary, and others. The postgraduate health providers actually train at Hamad Medical Corporation, and the programs for medicine goes into through Arab board and Qatari board with different subspecialties. The graduates from Qatar University, Cornell, and Calgary University are clearly seen. Qatar National Vision 2030 is very clear. It has 4 important developments: human, social, economy, and environment. And the human one is concentrating on education, healthy population, and capable, motivated workforce. And to take you through a strategy which is successful, strategy that's been established for the COVID, and during the COVID, we actually put a strategy very early on, and it worked very well based on preparedness, surveillance and detection, response and recovery. And I quote Arnold Schwarzenegger when he stated that strength does not come from winning. Your struggle developed your strength when you are going through hardship and decide not to surrender. That is the strength. And currently, the people who are already suffering in hospitals around the world, trying to provide the care for their patient, is struggling, and they are not surrendering. The leadership is also important. His Highness Sheikh Tamim bin Hamad was the first to be actually vaccinated against the COVID-19, as same as in 1957 when they started the vaccination for the smallpox. It is not only prevention for communicable disease, but also for actually cancer. And the mobile units that we established in 1957 continue to be serving the community. And Her Highness Sheikh Hamouza bin Nasser stated Qatar will be known not just for the work in providing health globally, but for providing the very best healthcare for its own citizens. Also, the establishment of Qatar Biobank is a critical, and Qatar Biobank partnership with researchers and the community is a very vital. Also, the precision medicine and personal healthcare with the Qatar Genome. Currently, there is more than 30,000 Qatari mapped for their actual genome. The budget for the health sector increased significantly, and in the last 2022 was actually had a stimulus to the economy and the health sector. So to conclude, and sorry to take more time, but the lunch was, I think, delicious, so that's why we started late. So the Qatar health system currently among the 20th worldwide and the best in the region. I wish actually Sir John Arthur Walton is here. He is the first British political agent in Qatar in 1949 when he said, Qatar in 1949 was not a particularly agreeable place to be. Decade of poverty, and during the war, near famine had led to mass immigration and endemic disease of dirt and malnutrition. The appearance of the capital Doha suggests that aftermath of an air raid, as unoccupied and even occupied houses crumble into dirt. I wish that he's around to see what Doha currently is. And I'll leave you with this video about Hamad, and if we can turn actually the audio. And
guided by Qatar's visionary leaders, we are committed to providing the safest, most effective and compassionate care to our patients for generations to come. We've come a long way as a health provider, but our desire to continue our journey remains strong. Our passionate and skilled teams have been providing specialist healthcare services to Qatar's population for more than half a century. Every day, we deliver care to tens of thousands of patients. Our labour and delivery teams help parents welcome their new babies into the world. Our paramedics rush to assist people in what can be the most distressing time of their lives. Our rehabilitation teams enable patients to maximise their recovery. And our trauma teams carry out emergency procedures to save patients' lives. Our transformation as a hospital system is unparalleled anywhere in the world. Yet our development has encompassed far more than just expanded capacity. Quality improvement is at the centre of everything we do, and our achievements have been formally recognised through a host of international quality accreditations. Our teams utilise the very latest medical technology, from surgical robots to hydrotherapy pools, telemedicine to advanced cancer treatments, pharmacy robots to ultra-modern air ambulances. Our patients benefit from cutting-edge treatment technology. We're proud to be recognised as an academic medical centre and teaching hospital. Through our academic health institutes, we are actively undertaking research into conditions that threaten to impact the health of Qatar's population, such as stroke, heart disease, cancer and diabetes. And we're committed to health promotion and education, understanding that as a national healthcare provider, we have a role to play in keeping people healthy and free from disease. The key driving factor behind our transformation has undoubtedly been our people. More than 25,000 skilled healthcare professionals from over 100 countries work together to achieve our shared goals.
Thank you very much. I didn't want to stop you because I'm fascinated with the history. So in addition to all the titles, you're also a historian, medical historian, we can say. Thank you very much. For sure, without history, we cannot understand the present, and you could see that together we can have much better healthcare system. So I will open for questions. If anyone has any question, please raise your hand so I can see you. Questions or comments or reflections? Yes, please.
Assalamu alaikum. My name is Muhammad Al-Na'mi. I appreciate this journey, which was exciting and amazing. I would like you also to elaborate on trauma care system in Qatar, as we have been working together on that since many years. Thank you.
The trauma care system in Doha was established in 2008. It was a joint mission with Pittsburgh University. And in the beginning, we had actually the trauma under the care of general surgery. But the establishment of the trauma system, because the need of the patient. We had the highest mortality at the time for the young population, less than 25 years old, compared to worldwide. We had close to 35 mortality per 100,000. So the establishment of this in 2008 moved into stages, establishing a trauma service, then a trauma system in 2012. That is taking the patient through the whole spectrum, from a prevention all the way to rehabilitation and integration into the community. With that, we are actually the only center or only system in the MENA region to establish this with a national trauma registry, and we are also contributing to the National Data Bank in the United States and benchmark the quality with American College against level 1 trauma center in the United States. The mortality dropped from 35 to 4.5 currently in Qatar, which is good. Yes, thank you.
It's brilliant, not only good. Thank you very much. Yeah. Please say your name.
I'm Dr. Waid Al-Ma'aita from Jordan. I just want to congratulate you actually for this important history, as well as, for all the achievements now. After, the whole journey, like you said, what is your vision, how you envision the future in Qatar for healthcare?
That's an excellent question, and this is a very difficult question to answer. So what I envision doesn't mean what's actually the current situation or the future. But I think we should look at our health sector as a special, and we should not copy an international health sector that failed or failing. By that I mean, we should not copy a North American, European, Australian. We should actually make a health system that works for us. Maybe the other health system is excellent, but it should not actually be copy and paste. We should tailor to the need of the population, and maybe actually can be better than North American. So what I envision is impacting in the policy makers, that copying an insurance, copying a quality program that doesn't fit the health sector is a not reflection of what we need to achieve. So there is a lot we can offer in terms of program, and what has been offered from 1960, a free service for all, shows that you are actually achieving a better quality of care for the citizen as well as the people who live in the country. So that's something we need actually to cultivate in the future plan, rather than embarking on insurance which may hinder the development of health sector. That's my opinion, not somebody else.
The best opinion, I think. Okay, more questions? Can I ask a question? Okay, no, we have one there. Okay. I will keep my question to the end if I will have time.
Hello, I just wanted to start off by saying it was an honor to listen to you today to talk about the achievements of Qatar. My name is Nawal. I'm a medical student from King's College London, and I'm leading the development of a mental health app specifically designed for the Muslim population. I'm quite interested in prevention of mental health, and I wanted to hear what kind of work is being done in Qatar for mental health prevention, and if there's ways that we could collaborate as well. Thank you.
Great. It's an application, so I need to know more to answer. But it's great. Anything that advances the patient care is a bonus for us.
Yeah, absolutely. Yeah. So if I can ask, what is the value that you kept in the system from the past through the present, and you will keep it also for the future? The value, the principle, or let's say the ethical value that you will always keep it, you will not compromise it, whatever happened to the system.
That's the patient come first. I think patient and their families are to be considered as a unit, which actually enhance the patient care. If we put these two together as the first, then we will succeed on their treatment. The second element is the healthcare provider. We need to actually achieve the best retention plan for the healthcare provider. As you know, we are a group of healthcare providers from different parts of the world. We have 100 nationalities at Hamad, and therefore retention, the quality, is very important by retention of the staff. So staff come actually first from administrative point of view. So that's the two components, being lasting from the beginning of the modern medicine in Doha. Staffing and patient come first. Yes.
Thank you very much. I
Thank
think
you.
this also can answer your question, because this is very important principle for prevention as well, for mental health and other things. Okay, I think we don't have more questions, but please, if we can also honor Dr. Hassan with the present, please. Yeah, thank you very much.
Thank you. Thank you very much.
So thank you very much, and you are invited to continue and enjoy the rest of the sessions of this day. Thank you very much.